Welcome to the Fragility Forum 2022 podcast series produced by the Fragility, Conflict and Violence Group of the World Bank Group. As complexity and uncertainty become the new normal, with complex crises posing new challenges, from the COVID-19 pandemic to climate change, this podcast series explores how the international community can best support countries affected by fragility, conflict and violence in a fast-changing global landscape.
My name is Patricia Fernandez, and I am currently a Senior Social Development Specialist with the World Bank in the East Asia region. In this episode, we're going to be talking about how evidence of what works to address gender-based violence in fragile and conflict-affected settings is changing the way we do programming. We're going to have a conversation with Rachel Pirati, who is a thematic lead for gender-based violence with the Gender Innovation Lab in the Africa region, with Pia Peters, who is the practice manager for the Social Sustainability and Inclusion team in the Middle East and North Africa region, and with Marcus Goldstein, the lead economist who heads up the Gender Innovation Lab in Africa. We're going to run through 6 questions with our speakers today, and we hope to leave you with a sense of what the available evidence on GBV in FCV looks like, what we've been doing to bridge the gap between knowledge and operations, and what is some of the new and exciting research out there. So we're going to start our conversation today with Rachel. And Rachel, the evidence that we have on what's effective to address gender-based violence has been growing. But what do we know specifically about what works in FCV settings?
Yeah, thank you, Patricia. Thanks for organizing this podcast. You're absolutely right. There is a growing evidence base to inform both gender-based violence prevention and response programming in fragile and conflict-affected settings. On response, I'd say very broadly, the evidence suggests that response services should be survivor-centered, meaning that they empower survivors to exercise choice, to exercise agency, and to make informed decisions about what types of services or support they wish to see. There are global guidelines for integrating gender-based violence interventions in humanitarian action that are a really good starting place for thinking about gender-based violence response services. There's also a growing evidence on sort of more specialized services that can be beneficial for survivors of gender-based violence in fragile contexts. I'll give you one example. The Africa Gender Innovation Lab conducted an impact evaluation examining the effectiveness of a particular kind of therapy called narrative exposure therapy, or NET, for survivors of gender-based violence and other traumatic events in Eastern DRC. And we found, first of all, that therapy can be successfully delivered by non-specialists at community-based organizations, which is really important for its potential scalability. And then moreover, the therapy led to both short and medium-term reductions in symptoms of post-traumatic stress disorder and depression and anxiety. So that's one exciting piece of new evidence on the response services. On the prevention side, there have been advances in the research on both targeted gender-based violence programming and other types of interventions that can lead to reductions in gender-based violence when they are well designed and implemented. Of particular note, I think, are some recent reviews that find that economic support programs for households that are experiencing extreme poverty or other forms of hardship can reduce intimate partner violence when they're designed appropriately, even when they don't have components that are specifically targeting gender-based violence reduction. And this is obviously very relevant for households in fragile and conflict-affected settings. So just one last thing on that note, I want to mention this recent operational guidance note that was prepared by colleagues in SPJ called Safety First. And it includes guidance on how to leverage safety net programs to empower women and prevent gender-based violence. The note is based on World Bank operations across many contexts, not just FCV, but many of the suggestions in the note are relevant to FCV contexts.
Thanks, Rachel. Let me turn to Marcus here to just get a sense of how the World Bank has been contributing to this kind of global push by other development partners, by international research institutions, of how we can kind of fill some of the gaps we still have in knowledge about gender-based violence programming.
Thanks, Patricia. I think there has been sort of the biggest push I've ever seen in my career on this, on the evidence generation recently. And that's exciting, and I hope it is sustained. Outside the bank, we've seen a number of development partners push on this. Global Affairs Canada, the FCDO, for example, funded a global initiative called What Works Against Violence Against Women and Girls, which brought together a lot of the leading researchers in the field and started to develop more evidence, both on the prevention, mostly on the prevention side, some on the survivor side as well. And really some really surprising and neat results, like in Zambia, a fairly low cost counseling intervention showed really big impacts. So there's a bit of momentum that will hopefully be sustained outside. Inside the bank, we've also been working on this, as you indicated. The gender group has been serving this key role to bring together knowledge and help spread it throughout the bank. And I think one of the things the bank brings to this space is the fact that we're multi-sectoral. So Rachel alluded to this. We're learning about violence in different types of interventions, other than those that are really expressly targeted to violence. And that's, I think, super cool. And we're the sort of place where it's really good to do that. And I think one thing I want to really stress about the way we've been doing this inside the bank is really partnerships, and not the sort of lip service partnerships kind of thing. I think that there's been a really cool and meaningful collaboration between researchers and operational colleagues in thinking through how these things are going to work in theory, and then looking at the empirical evidence together. And it's not just, the bank here, it's really meaningful partners with NGO and governments. And I think part of what makes that work is, I was like trying to think of the right word, and it's not agnosticism, because there's real theory and belief that these things are going to work, but there's a deep, rigorous questioning, and not taking anything for granted in terms of the impacts of what our programs will be, that really makes this a super exciting place to work.
Oh, that's great. Thanks, Marcus. I think from where you sit and at this kind of link between the knowledge that's being generated and the operations, particularly in Africa, how have you seen it really? How have you seen the analytics and the knowledge change some of the ways in which people are programming?
So I wanted to make 2 points about this. I think first, getting evidence used isn't just about publishing work and briefs and BBLs. Those are necessary, but definitely not sufficient. I think it's a collaborative process where the folks who led the research work with teams to craft and adapt the lessons in practice. So that's sort of thinking about the process of all of this. And when I look at how it's happening, I think there's sort of two main ways to categorize it. The first is bringing lessons about gender-based violence to non-gender-based violence projects, because now we're doing, thanks to the efforts of people like Pia, we're actually doing standalone gender-based violence projects. And I'll come to those in a second. But these other projects, we're bringing lessons about mitigating, supporting survivors, preventing gender-based violence in. So, for example, in a recent safety nets projects in Cameroon, we worked with the team to bring lessons about what we were learning about couples-based interventions into the program, and in the process sort of came up with a new set of questions to learn about. So that's one avenue. And then I think and this comes back to the bank as a multi-sectoral place, when we think about the gender-based violence projects, we think about bringing sort of support for the economic empowerment and other dimensions of empowerment as well in. And so here, for example, it's a super exciting project in DRC where it's a gender-based violence project, but working with the team to bring in this really effective kind of business training to help support the women to grow their businesses. But we're also tackling the couple dynamics within that business training for the first time. So super cool, but multi-sectoral. So I'll stop there.
Thanks so much. And then, let's shift over to Pia, who is working in Middle East and North Africa region. And there, the team has made this concerted effort to put together a comprehensive gender-based violence action plan at regional level. And it would really be great to hear from you, Pia, on how the analytics is informing the kind of choices that you're making there on the operations and the policy dialogue, how you're drawing on the evidence to make some of the choices of what to do.
Thank you, Patricia. I think to mention first, we all know, right, that FCV context intensifies structural inequality and contribute to increase prevalence of gender-based violence, unfortunately, even more so for the vulnerable populations. No? So understanding what works and what does not work is even more crucial to address gender-based violence in this very challenging context. So when we put together the MENA Regional GBV Action Plan, we also did an in-depth overview of best practices. And that's a royal we, because this was done by a team in MENA from SSI in collaboration with the poverty team. So all the kudos to them. So we looked into rigorous evaluations to inform our action plan for GBV prevention and also for service delivery for survivors. And we looked specifically at programs that were directly relevant to the MENA context, including in our diverse FCV context for the region. But unfortunately, there are not many impact evaluations on GBV programming in the MENA region, be it for prevention or for service delivery. So we looked, of course, also at lessons learned and best practices from other regions. And there are a variety of areas where the data and evidence pointed us to some really important areas for increased operational engagement we're working on in the MENA region. And just giving a few examples, no? So we aim to utilize, among others, the health sector, which is, as we all know, a critical entry point for GBV programming. And primary healthcare providers are often the first point of contact for GBV survivors. So health services for GBV survivors should be integrated into existing health systems where possible, rather than providing standalone services. This came out of several impact evaluations from other regions. And as Rachel also briefly mentioned, we know from data that psychosocial support is critical for mental health outcomes for survivors in FCV settings. She already referred to the example of DRC. We also found a study from Iran in that case that shows that women affected by IPV benefit from trauma-focused interventions like narrative exposure therapy. So mental health support for survivors is currently an important part of the work that we are about to launch in Lebanon and hopefully soon in Djibouti. But based on the review, we also found that prevention efforts rely heavily on education in schools. For example, lessons of life skills, respective relationships, conflict resolution, gender roles, etc. And this is really important at all levels of schooling. And we also learned that school-based interventions are found to be particularly effective in preventing GBV when using participatory approaches and interactive methods. So working with schools on how to integrate GBV awareness raising, but also on information provision on available services is a key entry point. And school staff and teachers should receive, therefore, specialized training on how to address these topics, how to talk about it. It's very often very sensitive, and that definitely applies also for our MENA contacts. So currently we're exploring for operational entry points to be able to work in the education sectors, and we're potentially also with faith leaders, because they can really be a catalyst for change. And for that, we're doing some preparatory work in, for example, Yemen and West Bank Gaza, which we will hope will then lead to operational interventions. These are just a few examples. Thank you.
Thanks, P. I know that's a lot of really amazing work that's in the pipeline as well. But I know that before MENA, you also have huge amounts of experience of actually implementing, sort of overseeing gender-based violence programs in community health settings, no, like the Eastern DRC, for example. And I guess sort of from a first look, folks might think it's just too difficult to do impact evaluations in these settings. So I was wondering if you could tell us why it's important and also how it can be done.
Yes, we started in one of the easy parts of the world to do an impact evaluation on gender-based violence, at least for me. But I think it's, let's first take a step back. We know that there's growing knowledge, right, on what works to address gender-based violence, including in FCV, and Rachel and Marcus gave some great examples on that. But still, our knowledge on what type of intervention works is limited. At the same time, we know quality impact evaluations can be expensive. They take time, they're challenging to implement, even more so in FCV context. For example, data collection. Often you might not even be able to access certain areas, so you can collect data over time because there is renewed conflict, etc., etc. But what I truly believe is that knowing what works and what does not work in the end is cost effective. And our end beneficiaries really deserve to have the best interventions possible. So continuous learning is crucial. And going to your question, how do we do it in Eastern DRC? And I just want to share quickly 6 points, if I may. First, we build upon existing analytical country level work. And so through that, we knew that support for mental health at the community level is crucial for survivors of gender-based violence. But there was very limited evidence for programs at the community level that worked and that were cost effective. So as I mentioned, impact evaluations are cost effective and take time. And we have to be selective when to implement an impact evaluation. So first, identify a knowledge gap that you're filling. But you need to think about this in advance, because you need to build in your evaluation in the project design and not as an afterthought. So in the case of DRC, which is also, Rachel also referred to it, we included the evaluation in the project design, but also, for example, we included budget in the project design to be able to collect all the data necessary and was budgeted for in the project with IDA resources. But at the same time, this also allowed to rely on local mechanisms for data collection in often areas where it continues to be difficult to access that are impacted by conflict. And at the same time, when you build it in from project design, you make sure that your impact evaluation is operational relevant. A third point is to ensure government client ownership of the impact evaluation. So in the case of DRC, we developed the questions that we wanted to see answered through the impact evaluation together with the client. In this case, this was the social fund in DRC and the provincial health divisions. And so we had many workshops with them in advance, first to train them on what is an impact evaluation, and then together to identify the relevant questions. This really ensured ownership of them, keen interest to then also implement it, and at the same time, you build capacity of your counterparts beyond the projects. Fourth is that you need to ensure, especially in FCV settings, extensive technical assistance for the counterpart. They need ongoing, continuous technical assistance for the implementation of the impact evaluation, for example, to design the surveys, et cetera. And in the DRC, we had the pleasure to work with our colleagues around the table here. We did this together with Africa GIL, with dedicated staff, including in-country staff who were sitting in the country, in the offices of our country counterpart to continuously provide them with assistance. And it is really true that without their support and the knowledge that they bring to the table, the Africa Gender Innovation Lab, this would absolutely not have been possible. Fifth, you have to ensure budget for bank support. It takes time, as we talked about. You need to provide technical assistance and support over an extended period of time, and bank budget will not cut it. So you need to identify in advance significant trust fund resources to be able to do so, and to be able to have resources for an extended amount of time over, several years. Then sixth, we talk about FCV context. You have to be prepared for delays. We know, those of us who work in FCV environments, it requires flexibility. We continuously need to adapt to new circumstances and challenges. So also your impact evaluation will often be delayed. Can be, for example, because there is a delay in starting of activities. So you will have a delay in measuring the impact of your intervention you are investigating. It can be because there is renewed conflict, et cetera. But here, just don't give up. At the same time, be realistic about timeframes, and you have to be agile. And this might not always be understood by researchers. For example, if you work with universities to do your impact evaluation, they might help with the analysis, et cetera, and sometimes they're on a different time frame than our project is moving forward. And then lastly, I would say just do it. If we can do it in Eastern DRC, I'm convinced it can be done everywhere. You just have to be driven, tenacious, bring the right people on board from the beginning to support you in it, and keep the end goal of improving interventions for gender-based violence in FCV in mind, and then it will work. Thank you.
Thanks, Pia. That's great overview of the challenges and solutions, on this sort of on the topic. Let me just, as we're wrapping up, turn over to Rachel. So Rachel, where you sit as the sort of thematic lead for GBV in the Africa Gender Innovation Lab, what is some of the new research that you're seeing come out? And are there areas that are still very under-researched and where we should be investing more in?
Thanks, Patricia. I think I actually can be very brief because I'm just going to echo a lot of what Marcus and Pia have already said. I think some of the exciting research is some of the, for example, on response, some of the new research on scalable options for addressing the mental health needs of survivors. I think that's really exciting. On prevention, I think some of the work that the World Bank is doing is a really nice complement to a lot of the research that was funded under the What Works program that Marcus referenced, which really focused on evaluating community-based, small-scale NGO-run programs. And I see the World Bank now testing whether some of the lessons and some of the programs that were tested at that small scale can be brought to a larger scale. Often that's through social protection programs now, or just integrating the lessons into other kinds of economic support programs. Marcus referenced our program in Cameroon, where the Africa Gender Innovation Lab is working with the National Social Protection Team to test a sort of couples-based intervention. We're actually trying 2 different versions of this intervention. Integrated into this national program. It is targeting areas with a lot of refugees and insecurity. And we have had some challenges with implementation, of course, but we're learning a lot as we go about how to scale up some of the lessons from the evidence that exists so far. And I think going forward, we really need to just continue that work. We need more research on what can work at scale and in fragile and conflict-affected settings. So I'm excited to see the work of all of our colleagues at the bank as this moves forward.
Thanks, Rachel, and thanks, Marcus and Pia, for great discussion. I hope we left folks that were listening to us today with some ideas of what we know already, some new areas where more information and more analysis would be important, and also of a sense that it is feasible to collect this kind of information in really challenging contexts. And it's not only is it feasible, but it's also very important.
This wraps up this episode of the podcast series. Thank you for listening, and please check out our other podcasts. For that, and to learn more about the World Bank Group efforts in environments affected by fragility, conflict, and violence, please visit our website www.worldbank.org/FCV.